I'm Dr. Kelly Starrett with the Ready State. We often encounter friends and family and colleagues and clients who have just new onset low back pain. And oftentimes we just go to category 10 storm freakouts in our brain. It must be something gnarly because why would I be in so much discomfort? Remember that the brain is clever and it's prioritizing threats or disorganization of the nervous system as sort of tier 1. If we look at the nervous system, it would make sense that basically you could injure your ankle but still get along for your day because your ankle, while inconvenient, certainly is a primary threat to the organism. But if you have back pain, your brain is saying, hey, it's gonna be really difficult to feed ourselves and reproduce and move through the world. So let's go ahead and make sure that we are paying attention to this. So one of the things that we can do to try to de-escalate and desensitize that is just give ourselves permission to put in a little bit of safe force into the system. In this situation, we like to do some really simple isometrics of the lower body. So let me show you what I'm talking about. So I'm gonna take a big breath here. I'm gonna exhale and lay down, roll on my back. And in this position, already I'm a little bit differently organized than I would be in gravity. And so already I'm comfortable, my brain is supported, my spine doesn't have to do its normal job of connecting my upper body to my lower body. And so this is a real position of comfort. And if you ever tweaked your back, you know exactly what I'm talking about. So in this position, we can actually sneak in some really simple isometrics to get things working again. Remember, oftentimes pain is a big inhibitor of movement, and what we want to signal to the brain is that it's safe to move. So the first thing we're going to do is take a big breath in. We're going to exhale. As we exhale, we're just going to push a little bit through the heels. Now, I don't have to lift up and do a big heroic bird dog bridge thing. I just need to push through the heel a little bit to get my hamstrings and glutes working. And then while I'm doing that, I'm going to hold this for 30 seconds, and I'm going to work on taking big breaths in and big breaths out while I put that little load in. All you have to do is get a little bit of load in during those breathing. You don't have to be heroic. It doesn't have to be max effort, but telling your brain it's okay to get the glutes to work, to get the hamstrings to work, and take those breaths, really a nice tonic. Second thing we're gonna do is we're gonna bring one leg up and we're gonna push into one hand and we're gonna pull into the other hand. What we're doing here is we're signaling that it's okay for the brain to create force like walking. So if I push into this hand, I'm making my quads work, and as I pull into this hand, I'm making the hamstring or extensors work, right? And so I'm gonna push into this hand and pull into this hand, very mid-range. I'm gonna take a big breath in. I'm gonna exhale, start to generate a little force, and then again, I'm just gonna hold that for 30 seconds, nice and easy, and I'm just gonna work on breathing that whole time. And you'll see is that you're probably wanting to hold your breath and overdo it. Don't do that. Go ahead and just find a tension where you can take big breaths in and big breaths out. We're gonna switch sides and do another 30-second hold here. And if you can't tolerate 30 seconds, do 10 seconds, do 5 seconds. But idea here, nice long isometric loading with the back in a safe position, signaling to the brain that this is safe. Again, working on breathing as I push and pull. The last isometric is for the adductors. All we're gonna do is squeeze our thighs together. If I have something to squeeze, I can squeeze it, but I can just put my legs together or put my legs in a position. I don't need to squeeze a pillow. I'm gonna take a big breath in and then try to just squeeze my thighs. Just get a little motion in the adductors here. And again, if I want it feels better to do it in this position, I certainly can. You can put anything between your knees, but just a 30-second long squeeze. Once you've worked through left side, right side, you've done the little bit of midi bridge, and you've done a squeeze, go through that cycle one more time. Then you can repeat those cycles often during the day if you have a chance or you need to lay down and sort of just recover. But the idea here is let's get some nice simple isometrics into the lower body that says it's safe to fire up this musculature. Look, there's no threat and it doesn't make my pain worse. I'm breathing and loading. I take my exhale again, I roll on the side, I roll up, give myself a chance to reorganize and see, do I feel better, same, or worse? Simple strategies to get some loading in chronic back pain or acute back pain when we know we're gonna need to stand up and get back to our lives.